Yeah. There's this quote. There's a quote from Warren Buffett, where he's like, create a list of 25 things and prioritize them. Take your top five, and then throw away the other 20, because the other 20 are going to distract you from your top five. And that really resonates with me. And that's sort of the mindset I try to go into prior to.
Because usually things 6 to 25 are kind of easy to do, right?
Exactly, and they're
and then you get that dopamine mix fix, you know.
Yeah.
I've actually done something. No, actually you haven't.
Yeah. Exactly.
Actually you haven't.
Exactly.
Are there any rules like on like B2B medical sales you have to follow?
One of the big ones is that we can't pre-sell a device before it's approved.
Okay.
And so like for example, we have an LOI from the Rural Collaborative of Washington, which is they represent 28 critical access hospitals in Washington State. We have a letter of intent from them to purchase ultrasound services, and we all know what those ultrasound services are going to be in the future. But we specifically can't call out our telerobotic ultrasound system in that LOI, because that would be a pre-sale of a medical device.
So you may go to hospitals, but are there like nonprofits you can go to, like any nonprofit medical things out there you might be able to use it for?
Yeah, I mean anyone where we're specifically looking for folks who have lack of access to a specialist, and so so like some health systems, for example, are nonprofits. Nonprofit.
I didn't know that.
And so we've talked with a lot of them who are interested in what we're building.
And like I'm going to presume that this isn't like $1.99 thing you're selling. How did you figure out the pricing model? Or are you still figuring that out?
Talk to our customers. So we've got a pricing model. We've talked to multiple of our customers about it, and we'll pressure test that once we get FDA clearance and roll it out, and then we start receiving checks. But we're confident that our model will work in the environment that we're selling into.
Is it gonna be like a subscription model, or they pay for it up front and you're gonna charge like upkeep later on? Or?
Yeah, there's an installation fee for the hardware, which is basically a pass-through for us because we don't build the hardware. There's a per exam fee that we rev share, so the hospital pays us. We rev share that with the remote sonographer and the remote reader, the remote physician providing the diagnosis. And then we charge a subscription fee to the hospital just for maintenance.
So the hospital, they need like certain kind of hardware system, some kind of like software, Wi-Fi setup?
Yeah, so we provide them a turnkey solution.
Okay.
Because these are hospitals that are going from 0 to 1. They have no services today, and we're helping them build out their ultrasound service line. And so we provide a turnkey solution for these folks.
And these remote people do actually do the service. Like, how do you qualify them?
So they're sonographers. They've gone to school for 2 or 3 years. They've been certified to practice across all states in the U.S. And so they've already been pre-qualified.
Okay. And then like your software developers, like software development changes so much, right? How do you make sure they keep up the skills they need, right? Are you like paying them to go to school, or is this on their own? Like, how do you make sure they're,
Yeah, I'd love to be able to offer educational programs, and so with this next capital that we're raising, I'm looking forward to being able to offer that to some of our employees. But really, for me, as I mentioned, like the people we look for have a growth mindset, and so I want that to be inherent, like someone who's hungry to learn what they need to learn to get the job done.
Okay. How you do this, right? Like, someone gets out for your how you run a business. Do you have an open door policy? Can people come to you anytime they want to with the problems and challenges, or you're like, go see the other co-founder?
No, absolutely. I try to keep a tight relationship with everybody on the team, which is possible right now because we're only 7 people. I think it's gonna be harder as we scale, but for right now, like everyone in our company has a direct line of communication to me, and that's what I want.
So how do you do that when you join, like, knock on this plastic table, you raise all this money and you hire like 100 people, like, how do you keep that culture the same, right?
Yeah, lean on founders who have been there before. So So for example, one of our previous the Tacoma Venture Fund, local to Seattle.
Yeah, Dennis Joyce.
Yeah. Okay, they led our last round.
Okay.
And they have this event that they throw every year where they bring all their founders together. Some of their founders have built companies with hundreds, I think even thousands of employees, and I got to hear their perspective on some of the challenges they face, and a lot of those challenges around just communicating with the team. And so I'm looking forward to Doppel getting to that phase, and then me being able to lean on folks who have already been there to get advice, so that I can try to avoid some of the challenges that they face.
I think it's a challenge too. Like I think a lot of people in charge, I don't care what it is, business, whatever, they're like, yeah, I communicate everything. But you ask the people, like, what? What are you talking about? He's never said that. Maybe I said it one time. I sent an email out, dude. Like, are you kidding? Like, you got to communicate over and over and over and over again, right?
Yeah, which can be challenging.
And because you think, like, even like when you're pitching, right? You're like, man, I've said the same pitch 10,000 times. Yeah, but not to him. You know.
That one resonates with you.
Not to him. Yeah. And then how you do this, right? So let's suppose you talk to somebody at your company, or investor, or whoever it may be, right? And man, I gave a detailed pitch, everything explained, like, and the person says, I think you do this, and something completely left field, right? Are you like, man, this guy must be dumb as fuck to not understand this, or like, no, it's on me because obviously I didn't communicate the right way, right?
I feel like I've evolved from blaming the other person on the other side of the table to trying to look at the situation objectively and figuring out how I can, because I can't control.
Like, damn, like, it's a kindergarten level. I gotta go to pre-K level. I think everyone has a challenge though, right?
Yeah, I think so. I think so.
Like, how do you not get this? It's like 2 + 2 is 4. Like, what are you doing? Yeah.
Yeah, and the challenging part is to really understand why and try not to over-index on the person who doesn't understand because they weren't listening versus the person who didn't understand because your message wasn't clear. You know what I mean?
So let's talk about founder advice, right? So like you have all these people on your advisory board, different people helping you out, Evan Poncelet, Dennis Joyce, but all advice ain't good advice, right? So how do you decipher, like, okay, thank you, but I'm gonna go a different way?
Yeah, I feel like that's one of my strengths, which is I love drinking from the fire hose. Like I want a bunch of smart people around me giving me advice, and then I will filter that advice and make the best decision. I feel like that's just something that
that's a great skill to have.
That I've developed over time.
What's like a pet peeve of yours?
Ooh, what's a pet peeve of mine that I'm gonna revise that I want to say over on this podcast. That's a good question. I don't know how I would answer that question.
I'll tell you mine. It's related, but like if I had like dirty clothes, I don't care on the floor. Like suppose I take some of the washing machine and falls on the floor, I just go batshit crazy, right? I can't stand for any clothes or clean to be on the floor, right? Just drives me crazy.
Yeah. I'm laughing right now because before I came here, I took my clothes out of the laundry and I went upstairs and I was rushing out, so I just dumped them on the floor. So I freed up the basket. So you probably hate me right now.
So let's suppose someone's watching this and like, man, Ryan just says he's gonna be doing some hiring pretty soon, right? Yeah. And their whatever skill set is, marketing, operations, whatever it is, like, man, I want to get involved with this. Like, what do they need to do to like kind of reach out to you and like kind of quote unquote impress you?
Yeah, follow us on LinkedIn, and then I would say find a way to get a referral to me. And this is the thing I wish I had a better method for this, but if someone emails me directly, it's gonna be challenging because my inbox is crazy.
Yeah.
But if you find someone that I'm connected with and they introduce off a strong recommendation, like that goes a long way. That's the best way to come talk to me, or find me in a networking unit. Come on Wednesday.
Yeah, actually, I'm gonna send an email to all the people demoing probably tomorrow or the day after, and let you know there's probably like 25, 30 people on the list who said they're coming to like look for jobs, right?
Cool.
Yeah.
Cool. Yeah, come talk to me then.
Yeah. So what do you and Doppel want to get out of this tech event I'm doing?
Just exposure. Show people in Seattle what we're working on, and connect with folks in the community who want to help us, who are interested. That's the big one.
So I don't know if you looked at any other companies demoing, but if you have any other demos you're excited to check out yourself. If the answer is no, the answer is no.
The answer is no.
Okay.
I haven't had the time.
Okay.
But, I'm looking forward to just seeing what other people are working on.
Yeah. So next question. What do you see the future? Well, let me backtrack. So you're talking about your company some, but go in more detail, like how the company got started, what you focus on now, and like your big dream future vision of it.
Yeah. So just basic problem that we're focused on right now is access to specialists. Further you get out from like an urban area, the less likely you are as a patient to have access to a specialist that can treat what you need, whether it's a diagnostic exam or an interventional procedure where they fix whatever's wrong. We're addressing that by enabling specialists to treat patients over distance through telerobotics or remote robotic diagnostic exams and procedures. We're starting with diagnostic ultrasound,